Stomach cancer is an oncological disease. Look at this picture, shows that stomach and cancerous cells, tumor. Then CT findings. Look at this MRI and barium swallow. X-ray findings. Look at this. A detail going on. Introduction. Stomach cancer, also known as gastric cancer, occurs when malignant cells form in the lining of the stomach. It is the fifth most common cancer globally and a leading cause of cancer-related deaths, especially in Eastern Asia and part of Eastern Europe. Stomach cancer tends to develop slowly over many years and is often asymptomatic in its early stages, making it hard to detect until advanced. Definition. Stomach cancer or gastric cancer is the abnormal growth of malignant cells in the stomach lining, often caused by factors like H. pylori infection, smoking, and poor diet. Early detection is challenging due to minimal symptoms, but treating typically involves surgery, chemotherapy, and targeted therapies. Types. There are several types of stomach cancer. 1. Adenocarcinoma. This is the most common type, 90% of all cases, and starts in the glandular cells of the stomach lining. 2. Lymphoma. Cancer that arise in the immuno cells, lymphocytes, present in the stomach lining. 3. Gastrointestinal stromal tumor. Rare cancers originating in the intestinal cells of Kegel in stomach wall. 2. Carcinoid tumor develop from hormone producing cells in the stomach and usually grow slowly. 5. Squamous cell carcinoma, rare and arises from squamous cells in the stomach. 6. Small cell carcinoma, a very rare aggressive form of cancer that forms in neuroendocrine cells. Causes. The exact cause of stomach cancer is not fully understood, but several factors can damage the DNA of cells in the stomach lining, leading to mutations that cause cancerous growth. Common causes. 1. Helicobacter pylori infection, H. pylori. This bacteria causes chronic inflammation and increases cancer risk. 2. Diet: high intake of salted, smoked or pickled foods and low intake of fresh fruits and vegetables. 3. Smoking and alcohol consumption. This increases the risk of developing gastric cancer. 4. Genetics. Family history of stomach cancer or inherited genetic conditions like hereditary diffuse gastric cancer syndrome. Risk factors. Factors that increases the risk of stomach cancer. 1. Age. Most cases occur in people over 60. 2. Gender. Men are twice as likely to develop stomach cancer as women. 3. Ethnicity. Higher prevalence among East Asians, South Americans and Eastern Europeans. 4. Previous stomach surgery. Those who have had part of their stomach removed are at high risk. 5. Pernicious anemia, a condition that decreased stomach acid associated with increased cancer risk. 6. Obesity linked to cancer development, especially in the upper part of stomach. 7. Family history. A history of stomach cancer increases personal risk. Complications. Stomach cancer can cause several complications, especially in advanced stages. 1. Metastasis, spread to other organs such as the liver, pancreas, lung or lymph nodes. 2. Gastric obstruction, tumor growth can block the passage of food leading to obstruction. 3. Malnutrition, difficulty in eating due to cancer or treatment side effects. 4. Bleeding, cancer can cause bleeding in the stomach leading to anemia. 5. Perforation, rare cases the tumor can perforate the stomach wall causing life-threatening conditions. Pathophysiology, stomach cancer typically begins with damage to the stomach muscle cells. In most cases, this damage is due to chronic gastritis, often caused by H. pylori infection. The continuous cycle of damage of repair leads to mutations in the DNA of genetic cells which promote uncontrolled cell proliferation. As the cancer grows, it invades deeper layers of the stomach and can spread to other organs via the bloodstream or lymphatic system. The pathophysiology of stomach cancer involves several steps leading to the development of malignant tumors. Here is a step by step process. 1. Chronic gastric inflammation. 2. Cellular damage and DNA mutations. 3. Precancerous lesions, metaplasia and dysplasia. 4. Uncontrolled cell proliferation. 5. Tumor formation. 6. Angiogenesis and metastasis. This multi-step process may take years, progressing from chronic inflammation to invasive cancer. Signs and symptoms. Early stage stomach cancer may not cause noticeable symptoms. As the disease progresses, common symptoms include 1. Indigestion or persistent heartburn. 2. Bloating after meals. 3. Unexplained weight loss. 4. Stomach pain. 5. Nausea and vomiting, sometimes with blood. 6. Difficulty swallowing if the tumor grows near the esophagus. 7. Fatigue due to anemia. 8. Dark stools indicating bleeding in the stomach. Diagnosis. The following diagnostic methods are used to detect stomach cancer. 1. Endoscopy. A cancer is inserted into the stomach to visualize abnormal areas and take a biopsy. 2. Biopsy. A tissue sample is analyzed for cancerous cells. 3. Barium swallow. An X-ray examination of stomach and esophagus after drinking a barium solution. 4. CT scan helps assess the extent of cancer spread. 5. PET scan evaluate cancer spread by detecting areas of high metabolic activities. 6. Blood test including tumor markers like CEA, carcino embryonic antigen and CA. Nursing diagnosis. Nursing diagnosis for patients with stomach cancer may include 1. Imbalanced nutrition less than body requirements related to reduced food intake and malabsorption. 2. Acute pain related to tumor growth or treatment side effects. 3. Anxiety related to diagnosis and uncertainty about prognosis. 4. Risk for infection due to compromised immunity from treatment. 5. Impaired swallowing due to obstruction or tumor location. Management. Management focus on providing physical and emotional support to patients. 1. Monitor nutrition, ensuring adequate intake and considering internal nutrition if necessary. 2. Pain management, using allergics and non-pharmacological methods. 3. Emotional support, counseling and support groups for patients and families. 4. Infection prevention, monitoring for signs of infection and implementing strict hygiene practices. 5. Post-operative care, if surgery is performed, monitoring for complications like bleeding or infection. Treatment. The treatment of stomach cancer depends on the stage and types. Common treatments include 1. Surgery, removal of part or all the stomach. Gastrectomy is often necessary, especially in early stage cancer. 2. Chemotherapy, often used before or after surgery to shrink tumor or killing remaining cancer cells. 3. Radiation therapy may be combined with chemotherapy to target residual cancer cells. 4. Targeted therapy, drugs that target specific genetic mutations or proteins in cancer cells such as HYGERE2 inhibitors. 5. Immunotherapy, boost the immune system to attack cancer cells. 6. Palliative care, focused on relieving symptoms and improving the quality of life in advanced cases. Psychosocial medicine. Patients with stomach cancer often experience significant emotional, social, and psychological challenges. Psychosocial medicine addresses 1. Depression and anxiety. Counseling or medications may be needed to address mental health concerns. 2. Body image issues. After surgery, patients may struggle with changes in appearance of function. 3. Social support. Support groups and counseling for patients and families help in coping with the diagnosis. Prevention. While not all cases of stomach cancer can be prevented, several measures can reduce the risk. 1. Healthy diet, emphasizing fruits, vegetables, and limiting salt and smoked foods. 2. Quiet smoking and reduce alcohol, smoking cessation and moderating alcohol intake. 3. Treat H. pylori infection. Early treatment of H. pylori infection reduces the risk of gastric cancer. 4. Regular screening for individuals at high risk, particularly those with family history. In conclusion, stomach cancer is a significant global health issue with potentially serious outcomes if not detected early. It asymptomatic early stages make prevention, awareness, and regular screening critical. Advancements in treatment, including targeted therapies and immunotherapy, offer new hope for improving survival rates. Comprehensive management, including medical, surgical, nutritional, and psychosocial support, is essential for holistic care of patients with stomach cancer. Thank you. Have a nice day.